So we use a mnemonic to remind us exactly what are the signs and clinical characteristics of myeloma, which is called CRAB. The C meaning the high calcium levels, the R meaning renal, but really renal is just a medical term for kidney function. A meaning anemia or low red blood count, and B meaning bone disease, or those holes in the bones that can cause fractures. Myeloma is the second most common blood cancer behind lymphoma overall for in the United States. We diagnosed about 35,000 cases this year, and I'll show you the incredible thing is that there are more and more people living with myeloma in the United States. Okay. In large part because people have stopped dying of the disease, and I'll show you a graphic on that in a second. It's a disease of older people. As I get older, that term becomes less and less important. But it's a disease of adults that you never see myeloma in kids. Okay. I think one striking thing that you can see is that the incidence in blacks are much higher than it is as for whites, and we'll kind of dive down into that right now.
Which is why I said in my opening, that's why we're doing this programming, because myeloma, when we're talking about those three blood cancers, myeloma, the incident rate in African Americans is really high, and so we have to. Or people of African descent.
Yes, twice as high. And it's more common in men than in women. But it's actually twice as high in people of African descent. So that's just not the United States, but that's around the world. So, there were reports.
That's the title, Blood Brothers, right?
Yes, exactly. I was happy to see that title because that's absolutely the truth, is that men and Black people have, people of African descent have a much higher rate, the highest rate in the world of this disease. Right. People of Asian descent have the lowest risk. Hispanics and whites are kind of in the middle. And you can see on that graph that Blacks and green outpace all other races. And then you look at, as we get older, a Black individual or age 85 has the incidence is about 75 per 100,000. So it's very common in our oldest group of Black individuals, and again higher in men, which again that's why your title I think is very timely, because that is who is most affected by this disease.